Mike Gibson and Ronald Crystal, and we're talking about treatment using gene therapy of Friedreich's ataxia and its associated cardiomyopathy. Ron, talk to us a little bit about what you did.
Well, first we had to make a decision of what to go after in terms of the disease. The disease is both neurologic and cardiac. Neurologic disease starts in childhood. The cardiac disease usually manifests later in 20s and 30s. The reason we went after the cardiac disease was that's what's the lethal in the disease. 65%, 70% die from cardiac disease. And so even though the neurologic disease is disabling, the cardiac disease is lethal. And so the strategy we used was the gene that is responsible for the disease is the frataxin gene, which functions in mitochondria to generate energy. That's why the neurologic and heart, or the brain and the heart, are so involved, because they're the organs that use most energy in the body. And we administer the vector using an adeno-associated virus vector, which is trophic for the heart. And we're delivering the gene called the frataxin gene to the heart. And at least in animal models, we can cure the disease.
And what did you find?
Well, we've treated a total of 17 patients now. And so it's still early. But cardiac biopsies demonstrate we can deliver frataxin to the heart. And we use two major criteria. One, cardiac MRI criteria of the thickness of the heart, because it's a cardiac hypertrophy disease. And so LVMI, left ventricular mass index, was measured, and that decreased in most of the patients. And the other parameter we used was high sensitivity troponin I, a structural protein in the heart that's used for diagnosis of myocardial infarction, for example. These individuals had very high levels at baseline, and in almost all the individuals, we suppressed the troponin levels. So
Wow, how much did you suppress them? I mean, did they go back down to normal or
in several,
a
they
few
went to
fold?
normal. And most of our patients still had normal ejection fractions, but one of the patients had a ejection fraction of 35%. And that patient, not only did the troponin levels normalize, the LVMI levels normalized as well, but the ejection factor went to 74%.
Really? Wow,
So
that's
it's
amazing.
encouraging. We obviously have to
Yeah.
do larger studies to be able to prove that it works, but it's very encouraging. And I might also mention in terms of toxicity, that there was very limited toxicity. One of the patients developed myocarditis out 12 months after therapy, so it's hard to link it to the therapy, but that was treated and was suppressed with corticosteroids.
Fascinating. So what is your next step? What's the next phase of all this?
Well, what we're doing is two things. One is, so there were two studies. One was our academic study, which was funded by the Heart, Lung, and Blood Institute, and then company Lexio Therapeutics that I started many years ago took over, and they carried out a study. The two studies were actually independent, and we decided to combine the data. So, but the studies were carried out independently. They're moving along in terms of to get approval of the therapy. We're moving toward more lower age group. So our age limit was 18, but we've now been approved to go to age 12. And so we're going to start treating children in that age group.
Wow. Well, congratulations, Ron. That's really exciting. I'm embarrassed I hadn't heard about these efforts till now. So very, very good stuff. Thanks for sharing today and thanks for joining us.